Okay, y'all, now I'm going to teach you about classification of burns. When we classify burns, we go by the burn depth. We also go by the total body surface area that's been burned, and that we do that with the ruling irons. That's like the easiest way I'm going to teach you how to do it because I think that's what you're going to get tested on in NCLEX. And there's some other factors I'll talk about, like when I talk about the severity of a burn, all right? But right now, I'm going to introduce you to burn depth. You are going to have to know these characteristics. So however you learn best, if you need to make index cards, but you're going to have to know these characteristics, okay? So let's start with superficial burns, okay? So this is just the top epidermis layer, okay? Epidural layer, I should say. So these burns are going to appear red to pink. They're going to be dry and they blanch. And an example of this is a sunburn. So just think of a sunburn when you see superficial burns. They'll have mild edema. They are going to have pain. If you've ever had a sunburn, you know it can be painful. No blisters, no eschar, and heals in 3 to 5 days because the epidermis is constantly renewing itself, and no grafting, okay? Now the next layer is the upper third of the dermis. That's the next layer we're going to talk about, and it's classified as superficial partial thickness. Now don't get this confused with superficial, okay? When it says partial thickness superficial, that means the top 1/3 of the dermal layer has been damaged. Okay, so now this is still going to be pink to red, okay? It's still going to blanch because there's good blood supply still, but it's going to be moist, okay? Because as those blood vessels are getting burned off, plasma is leaking out, okay, into that area. They are going to have a lot of pain. They will have blisters. Again, that plasma is leaking out, so that causes blisters. No eschar, heals in 2 to 3 weeks, and no graft. Okay, so that's superficial partial thickness. Now, the lower 2/3 of the dermis is deep partial thickness, and this is the color that's going to appear. White comes up now, so it's going to be red and white, okay, or maybe just red with a little white in it. So it could be wet or dry, and it's going to be slow to blanch, okay? Edema is going to be moderate. Pain, yes, they're going to have pain. Rare, the blister is rare. I would say pretty much that's a no. You're probably not going to see deep partial thickness with the blister. And then eschar is going to be soft. And then healing takes 2 to 6 weeks. And they possibly may need grafts, okay? So remember, with deep partial thickness, this is where we start worrying about scarring. That in the depths lower than that, okay? Full thickness. Okay, this is what I call like the rainbow. A lot of different colors show up here. So black, brown, yellow, white, waxy, charred. Those are some of the descriptive terms that are used to describe a full thickness burn. Okay, the edema is going to be severe at this point. Pain, no, and yes. Okay, so what do I mean by that? Their nerve endings are burned off, right? But they still can feel pain around the wound edges, and also they can still feel like pressure within the wound, okay? So they're still going to need to be medicated. I mean, I know it says in a lot of textbooks that they don't have any pain, but they still have some pain, okay? Even though it's no. It's minimal. Like if you hear of a big burn and the pain level is a 1 or the 2, I always automatically think it's full, okay? So the eschar is leather. Now, how you can remember this is the L in full with leather, okay? Because this is important to know that this is leather eschar. It's going to take weeks to months to heal, and they are going to need grafting. Let me tell you why this is so important to know with the leather, okay? If somebody they come in and they have a circumferential injury, okay? So let's say it's around their chest. And now they have leather eschar, which is inflexible. It doesn't move. It's like literally having leather wrapped around your chest, okay? They're not going to be able to breathe, so you have to watch them very closely. They're probably going to be vented if they have a circumferential injury around the chest, okay? But the reason you need to watch them closely is if they can no longer expand their chest, they're going to need an escharotomy, okay? Even if they're vented, because what's going to happen is the vent's not going to be able to press the air in, okay? And you could have like your high alarm going off, you know, remember that signals obstruction? So the physician would come and would do an escharotomy, and they can do it right at bedside. They just take a scalpel and make like hash marks in the skin, so now that the skin can open up and the patient can breathe again, okay? Now the other situation where you would worry about that, if it was on a limb, you would worry about compartment syndrome, okay? So remember your 6 Ps, okay? If somebody has a circumferential injury, burn injury, that's a full thickness on their arm, okay? You're looking at the pulse amplitude, remember that, okay? And, you know, you're checking for your numbness and tingling, and all that. Okay, deep full thickness, okay? The color here is gonna be black. They are not gonna have edema, they're not gonna have pain, no blisters, leather is still here with deep full thickness. It's going to take weeks or months, and they're going to need grafting. Okay, so what are some good tips to like remember this stuff? Okay, first of all, it depends on how you learn. If you're like a pathophysiology buff, you might just like learn the skin A&P, and you might like be able to figure, because that's the way I learn it. I can figure it out that way. You might like to look for commonalities. Like if you go and you start at superficial and you know your way down, it starts off red and pink, stays red and pink, right? Blanching, slow to blanch, and then no blanching. Okay, that might be a way for you to do it too, okay? And then notice when the colors come up, like deep partial thickness, white comes up here. And then this is the rainbow in full thickness. And then it's black in deep full thickness. And then if you look at the edema, it's mild, then it's mild to moderate in the dermal layer, because that's where the blood vessels are like burned off, so the plasma is leaking. That's the way I kind of think of it. And then with full, the edema is severe still, and then none with deep full thickness. And then with pain, they all have pain until they get to full thickness, but I told you they still are going to have a little bit of pain, right? And then the blisters, the only one that really has a blister is superficial partial thickness. Okay, so it's going to have a blister. And then with the eschar, we don't see the eschar we really worry about, because it's going to kill them if you're not on top of their respiratory excursion, is full thickness. Okay, and then the other things with the grafting, it's the deep partial thickness where we're worried about scarring, that level and below. Okay, so they may need grafting, but definitely when they get to full thickness, they will need grafting. In deep full thickness, they're going to need skin grafts as well. Okay, so that about does it for depth. Okay, and we'll see a video in class too, and that should help you kind of organize yourself.